So with any kind of treatment, the real question is whether it is appropriate for the situation. And if the goal of the situation is to recognize that this is the end and that the landing is going to be a soft landing, and that whether the soft landing happens a month from now or a week from now or tomorrow doesn't really matter. What matters is that the landing is soft. Things like antibiotics probably aren't very helpful. It's really much more about controlling symptoms rather than controlling infections. So that's the first decision, is kind of where we are, where we're going. And then from that point, you can make decisions about individual treatments, such as antibiotics. For somebody, antibiotic might be an appropriate choice because they're having a lot of symptoms with their fevers and such like that. But for most people, those kinds of symptoms can be controlled with other medicines, such as Tylenol or aspirin, to control the fever. So it really, what the treatment is really follows what the goals of the treatment is. I think those conversations about really the close of life happen when there are limits to medical treatment. So for example, if there is an operation, if there is a procedure, if there is something that can be done to take what's broken and fix it, those conversations typically don't occur. But if you're in a situation where what the best medicine has to offer isn't going to turn the tide, it's time to begin thinking about that. And here we begin to open up that conversation by saying, you know, we can give you X number of years, or we can achieve this kind of health goal. We can control your blood pressure, we can control your lipids, we can control your diabetes, to saying what's important to you. You know, if your time is limited, what do you want out of it? And sometimes they follow their doctor's advice to just keep going. Sometimes they tumble to the concept and say, this just doesn't make sense anymore. And we have to have a different approach, and maybe they'll go to a different doctor, or they'll get a second opinion, or they just won't listen to what the doctor has to say. Yeah, getting a second opinion is always a good idea. And as a physician, and many of my patients have gotten second opinions, you initially have this kind of feeling of rejection. You say, geez, you know, what did I do wrong? Or, you know, the problem is not me, the problem is the patient, etc. But generally, if one of my patients gets a second opinion, it's generally helpful. And sometimes it's helpful confirming what I originally had thought, and sometimes it's helpful in opening up new ways of thinking about things.